Let's introduce to you the Periotomes made by TBS Dental. As you'll notice, the Periotome comes in a very nice cassette with 4 different styles. We have a straight to be used for the anterior region. And then there are 2 angled, one which is perpendicular and one which would be more straighter towards the concavities of the roots. Lastly, we have a concave shaped peritome which has serrations, as you can see, and it has a concavity, and this can be used really well to extract root tips if you need to apply a little bit more force. Keep in mind, when using peritomes, they are used to separate the tooth from the periodontal ligament. They are not to be used for extraction purposes. However, this concave root tip extractor may be used with a slight amount of pressure. What's very unique about the Periotome from TBS is that the ergonomic use, being able to hold it in a pencil-like fashion, very fine serrations, as you can see at the edges, the ability to twist and turn just ever so slightly in between the roots. So let's take an example of an extraction. For the straights, we would like to follow on a 90-degree or parallel towards the tooth surface and just separate the periodontal ligament. And we'll do so on both sides, buccal, lingual, and mesial and distal. The serrations allow us to get deeper and more aggressively advance through the periodontal ligament, through the gingiva, separating the periodontal ligament. Again, the goal not to extract the tooth, but purely to separate the periodontal ligament, the sharp grease fibers, from the cementum and the dentin of the tooth. And we can switch to perpendicular for both the distal. And again, we would like to always try, when we're doing separation of the periodontal ligament, to wiggle slightly so that we can get in between the periodontal ligament. Again, not to try to elevate the tooth, simply to separate the periodontal ligament. As you can see here, we can apply the same type of pressure and try to elevate, as these are thicker and can help us extracting a root tip. Once extracted, the Periotome Kit does come with a micro curette with serrations, and we would debride the area, going on all surfaces, being able to use it in both motions to clean out the socket after extraction to remove any periodontal ligament, granulation tissue, or granulomas that may be out of it.